can't shake the simplest feeling beyond the ghost. We stand on the opposite shore. Hello, moon.
All right.
I reach through mysterious ceilings, my only hope. I look.
All right. Hello, DMV. This is Ramona Jones with Claim. I am your insurance guru, and we are here live from 11707 Ricestown Road, and where we talk about all things insurance. I'm so happy today to have my friend, Mr. Jake McGoey, back with me because next week, October 15th, is open enrollment. Open enrollment. Open enrollment. And what does that mean? That means everything that you thought about medical insurance is just falling apart.
Sunday is the day.
But it is going to be some upside down stuff going on, I think. I don't know. I'm trying to read the information that's coming out about Medicare because October 15th is where all of the seniors 59 and a half and above that are on Medicare can go out into the market and figure out how they can pay more money out of their pocket next year. No, I'm just joking. But what kind of coverage they need based on what they experienced for the last 12 months and what is necessary for them to do in order to make sure they get the best coverage they can get. So open enrollment, what does that look like, Jake?
So this Sunday, the 15th, it starts technically at 12:01 a.m. that day. You are eligible if you are a Medicare beneficiary, you're eligible to actually sign up and enroll for a new plan for 2024. The effective date of any enrollment would be January 1st of 2024. This period runs from the 15th all the way up through December 7th. So anyone who's currently on a plan can change it. If they don't have any plan at all, they can pick one. So again, it's not to change anything about your Medicare A and B, your base coverage, but it's to add, drop, or change your drug Part D plan or a Part C, which is Medicare Advantage plan. A lot of people confuse.
Or to sign up if you just became in that eligible age thing.
Well, so that when you're first getting your Medicare, when you have your 65th birthday and you're first eligible for Medicare, that you're allowed to sign up, that when you're the first day of the month of your birthday. So that gets its own election period. That's called the initial election period. So that is the first time, and so you have that one time only, when you're first eligible. But the annual enrollment period is every year. You have the option to change that. A lot of people confuse the fact that they have two choices for the major wraparound for Medicare. They have the Advantage plans as a option, or they have the Medicare Supplement plan, which is a different type of plan. The supplement plans are not, they don't follow the same guidelines as far as enrollment periods. Medicare supplement plans, you can start or stop anytime throughout the year. There is no guidance on it because there is health underwriting involved in starting and stopping those plans, at least once you've been on Medicare for more than 6 months. When you're brand new to Medicare, you also get an initial period for that. But once you're on for more than 6 months, the supplement you could change anytime throughout the year. But it does make sense if you're talking to your broker or you're out there asking questions about, your drug plan or your Advantage plan. It's a good time to also check on this supplement option, or if you're in a supplement, to check the price and see if there's something that maybe would be better for you.
If you're disabled, and disabled people are being switched, and that wasn't always the case, but are automatically being switched to Medicare, how does this enrollment people affect that group?
Well, so the rule or the way that it works is you're eligible to get your Medicare when you turn 65, or if you're under 65, if you've been deemed permanently disabled by Social Security and you're collecting SSDI, then on the 25th month, so 2 years of being on full disability, the 25th month Medicare starts automatically. Now, there are situations that work out to seem a little different, but that's because they backdate, from the time somebody gets approved on disability. Sometimes oftentimes they've gone through, proceedings and declines and had to, appeal and all that. So whenever the determination is made of when the disability started, that's, if they backdate that when the 25th month from that backdated date. So it could be that you just got approved for disability and you go on Medicare immediately. That's because you've been fighting it for 2 years, and you know what I mean.
Right.
And 24 months has already passed. But that is the other way that you get on Medicare. That way that you would be getting on it at a younger age is by being deemed permanently disabled by SSDI. I'm receiving SSDI.
Now,
So those people, they have the same enrollment period. They have the same eligibility. If they're on Medicare, it doesn't matter if you're under 65 or you're over 65. The annual enrollment period is the same. It's still here every year for you to make those changes.
but the group that's under 59 and a half, they're not allowed to get a supplement. There is no supplement available.
Right. Well, so yeah, so that is a variation that varies. It's by state. That has to do with state laws. Medicare doesn't require a Medicare supplement company to offer a plan to someone who's under 65. It's each state that sets the laws regarding that, because a Medicare supplement is not governed by Medicare. It's not a part of Medicare. It's a supplement to Medicare. So that does get very confusing for the consumer. But yeah, so under 65 in Maryland, you have one time when you first get Medicare approved, you have a one-time shot to pick, but it's only limited letters that you're offered. The plans that you're offered are much more expensive, and so in many situations, it effectively means that you can't get one. Once you're past that first 6 months of having your Medicare, until you turn 65, you'll at that point get a new initial period to use. But until you turn 65, you can't get a Medicare supplement if you miss that first little window.
I see. Where can people go to find out? Because I've got a child that's disabled. He's 27 now. When he was younger, he was just covered by Medicaid.
Mm-hmm.
Because that's the rule in Maryland. If you receive SSI, you're automatically covered by Medicaid. I did not know until, I guess, 2 years ago that he had automatically switched over to Medicare.
Yeah, so I think that, I can't speak to why or when that happens exactly with the same level of confidence that I did on the last couple of questions, but I will say that yes, in many cases, especially when you're talking about a child, when they're under 18, there are some different rules and things around that and how it works, and oftentimes it's that they have both, at least from the time they're 18. I have seen people under 18 have Medicare. In situations, but very, not very common at all. Obviously, because you'd have to be disabled and have a disability. But yeah. So I'm not sure exactly how that works, but I will say that whether or not you have Medicaid, Medicare's enrollment periods and the annual enrollment period is there, and a lot of people. I do see talk to a lot of people out there that they have Medicare and Medicaid, because again, Medicaid you qualify for by your income. And assets, right? So they look at your income. If you have limited resources and limited income, then you may qualify for Medicaid. But just because you have that doesn't mean that you don't need anything else, because Medicare will provide 80% of your healthcare coverage, and if you have Medicaid with it, they will cover the other 20% of the healthcare needs that Medicare's covering. But then there's
Right.
other things that aren't included in that, like transportation and dental and vision and hearing benefits and other things, safety devices, durable medical equipment, diabetic supplies. There's a lot of stuff that's not necessarily going to be included, where if you did go out and look at the different options that are there and talk to a broker like myself or one of the folks that works with me, you'll find that there are programs that work that are specifically for people on Medicare and Medicaid. There's programs for people that are just on Medicare. There's programs for people who aren't on either. So there's a lot of different things out there. But the number one thing that I see people regret the most is trying to figure it all out themselves. I mean, if I didn't do this for a living, there is no way on earth I would be able to navigate all this stuff for people.
Absolutely.
And just like it's if I have a question about a lot of the other insurances that that aren't what I do, I would come talk to you, because I don't have a clue. You know what I mean? Like I just don't. You can't keep all of it straight. It's impossible.
Yeah,
Um,
absolutely, especially the Medicare. My daughter is studying for her life and health license, and she was like, "I got all the other stuff. It's the Medicare part. It's just I don't know what they're talking about." For
yeah.
example, so one of the changes coming up for 2024, it says Medicare Advantage changes for the rates for MA rates and Part D. They keep talking about this growth rate, right?
Hmm.
So the growth rate is, oh, and the star rating. I'm not exactly sure what the star rating is. However, this is affecting what premiums are going to be in 2024. So, of course, there's this whole thing about the cost of living increase that Social Security had last year, and they're having
Hmm.
another one, 3.2% again this year. But then they're saying that they're not even going to see the cost of living increase because Medicare is going up 3.3% or something like that. So they're going to end up paying $1.24 more. I don't know how. I'm guesstimating. Um,
Well,
but
there's
well,
actually
what
a
is happening to the Medicare premiums?
so the Medicare premiums are they say are estimated to go up. I haven't seen any final numbers for sure. Right now, whatever we're seeing right now is the estimates based on the someone else doing the calculation, and nobody's actually finalized it and put it in written in stone yet. But those changes occur every year. They are based on a bunch of factors. It has to do with the cost of living, factors like the cost of a gallon of milk, the cost of a gallon of gas. They take those different things into consideration, and they look at it.
Right,
What's the change been? That's the cost of living increase with the income for Social Security. The Medicare premiums they do based on what they estimate the expenses are, and that has a lot to do with like what they're paying for the average drug, or the different drugs that they're subsidizing for people, and that kind of thing. So I will say though that there's a provision that a law that's in place that says that your Social Security income cannot be decreased as a result of an increase in your Medicare premium. So
okay,
so there is a very solid possibility that you get a raise in your Social Security, and the Medicare raise completely wipes that out. So you don't see any change in your monthly benefit, but it is not possible that it goes in reverse. Like, in other
okay,
words, they can't raise it so much that you get less money per month.
okay,
And if they do raise it, well, matter of fact, I mean, that's the cost of Medicare has gone up enough that if that thing wasn't in effect, people that have been on Medicare for 10, 12 years would have gotten less every month, or every year, but so right now they're paying less in many cases than what a new person's paying for the Medicare Part B because of that rule. you know. So anyway, not to get too complicated on it, but
No,
you
that's okay. It's very complicated. So I'm also reading here that there are some estimates that the cost sharing for Part D drugs, um, that that the subsidy will increase for those who are 150%, from 135 to 150%, below the federal poverty level.
yeah. So
So it's
the
going to include more people than it did before,
yeah.
but it's going to cost us more.
Well,
Maybe.
so there's a program that the Social Security Administration does. It's called Extra Help. It used to be called LIS, Low Income Subsidy. Now they
Right.
call it Extra Help, the Extra Help program. So they'll say, you know, do you receive extra help from Social Security for your drug costs? And that used to have 4 different levels. So they broke it out by like your income as a percentage of federal poverty level. You could be 100 to 135 was one level, 135 to 155 was another level, and then so on and so forth. And they had 4 different levels. And based on the level that you fell into, you would have a different copay for the meds that you picked up. They would guarantee that your copay for your medications was not more than a set amount, and that was a different amount for each level. Now
Okay.
they're doing away with that, and they're just saying if you fall in this big broad range, there's one level, right? There's just one level. Everyone's going to get the same copay. They're going to have the same amount. So that's nice because it's simplified a bit. Now it does cost more to do that because they're including more people in the benefit that they're giving, or in a larger benefit than what they were getting. But there's also been a number of changes to the Part D structure with the Inflation Reduction Act. That actually had a couple of impacts and improvements to the Part D structure for the Medicare beneficiaries. So, for example, in 2024, if you reach the catastrophic limit on your drug usage, which is stage 4 of drug coverage, you don't have to pay the 5% anymore. They're taking that away. So it used to be this year, you have your drug coverage, and you had 4 stages of drug coverage. You have your deductible stage, if it applied, does with some drugs, doesn't with others. And then you had your initial coverage stage, which was, you go to the store, you pay $5 for this and $2 for that, or $45 for this brand name. Then they had stage 3, which is the donut hole, right? That's the scary donut hole everyone talked about. That used to be you paid 100% before the ACA, Obamacare plan came into play. They adjusted that. Instead of being 100% of the cost of the drug,
Right.
they lowered it each year down to where now it's 25%.
Okay.
So when you reach the donut hole now, you pay 25% of the cost of the drug rather than 100%. And then after a certain point, of a certain amount of cost worth of medications being filled, you
Right.
come out of the donut hole and you go to the catastrophic phase. And right now you pay 5% in the catastrophic phase, but next year you'll pay 0. So at the end of the donut hole, it's over. Everything is free at that point. It's
Okay.
zero cost, we're supposed to say, not free.
Does the donut hole have a limit?
Yep. There's the numbers for this year. Let me pull it up. I can tell you. For when I say this year, I mean 2024, because that's what we're looking at. So the 2024 numbers, the max deductible, which is stage 1, is $545. Again, that's the maximum. That's the maximum.
On the left side of the donut hole.
Yep. Then the initial coverage limit is $5,030. So that means when you fill $5,030 worth of medications, you go into the donut hole. Okay? That's the total cost of the meds, not what you paid, but the total cost of the meds.
Okay.
and then the out-of-pocket threshold is $8,000. So to get into the donut hole, you would need to have picked up $5,030 worth of meds for the year. And to get out of the donut hole, it's a different calculation. It's the total out-of-pocket cost of the meds was $8,000. So that, but it's not actually what you spent. It's what you spent and what was discounted in the donut hole. When you're paying 25%,
right,
you're getting credit for like 90% towards
okay,
that 8,000, because the drug manufacturers are covering 75%. Or sorry, not 75%. They're 65%. They're covering. So the
okay.
65% plus the 25% that you pay both
It's
count
80.
towards the 8,000. So you do
90.
get there. You do get there. More quicker than you would think, just by hearing the numbers initially. But those are all of those numbers have gone up, which in some cases is good, in some cases is not. Like it was 4,660 instead of 5,020 this year. So in other words, you hit the donut hole at a quicker pace because you only had to spend 4,660 instead of 5,020. But to get out of the donut hole last year was 7,400, and this year it's 8,000. So each of those numbers shift a little bit based on the cost of meds and inflation and all that kind of stuff. So anyway, the moral of the story is definitely get a professional to explain all of those things and plug in your list of medications, because the thing that I could never tell somebody what's the best plan, quote unquote, for them to choose without a computer. There's no way. I mean, I could if it was really simple and they took like 2 drugs, I could probably look it up, but I'd have to go look at 35 different plans to see what the costs were on each one of them.
Right.
Whereas I can just go on my computer into the program that I use. I can put in the medications, literally as specific as how many milligrams, what pharmacy do you pick them up at, because that matters.
Right.
Because the
it
price
does
is
matter.
Oh, it matters. Yeah.
You
it
hear
matters.
that, listeners? It does matter.
Yeah. I mean, if you took the same list of 5 drugs and then plugged in 3 different pharmacies, the numbers are totally different.
Exactly.
At every pharmacy. And depending on which health plan. So like one drug plan works really well with CVS, but not with Walgreens.
Right.
And it won't work at all at Rite Aid. And it might work at Wise Markets, or it might work at Wegmans, but it won't work at Giant. Right. So
if you if you're a patient at Chase Braxton has their own pharmacy.
Yep.
And they also subsidize their own medications in different ways. So you may have a copay at Walgreens, but at Chase Braxton, they're covering it.
Oh yeah, yeah. I mean, and it's so funny too, because people every year I talk to people in the enrollment period like this time of year, and they say, "Oh, my plan is terrible, right? It's awful. They are ripping me off, and I'm on a different plan." And then I go in and look at it, and I answer all the information. I answer their drugs, and I answer the pharmacy, and then I say, as soon as I see the report coming up, I'm like, wait, you're going to this pharmacy? Well, no wonder you think your plan's terrible. That's not even a pharmacy that works with that insurance. So if you were to go to CVS, for example, you might have all your drugs for $0. But right now you're paying, $180 a month to fill your meds, but they'd literally be $0 over there. So it just has to do with the negotiations they have. They all make deals with different pharmacies, and every pharmacy has, they are getting different deals on the drugs too.
Yes, absolutely. Especially if you're doing things like insulin. A lot of that, there are a couple pharmacies, they sort of specialize in diabetic drugs, and they give you all kind of discounts. It looks like here too, must not apply with the deductible to any Part D covered insulin product, and must charge no more than $35 per month to supply. So that's something new that's coming for 2024.
So, well, there was a version or a portion of it that was in there. So that started about a year ago too, where they would guarantee that insulins wouldn't be more than $35. But the way that it was first set up had to do with it had to be covered by the plan. So in other words, each drug plan has their own formulary of which drugs they cover. So as long as it was a covered drug in the formulary, it would be $35. Now they're expanding that rule a bit more to make it a little bit more broad. And so, yeah, but the bottom line is definitely very good news for diabetics with the changes that have been made with anyone who takes insulin or insulin alternatives in many cases now, which weren't always on there before. Some of those Yeah, some of those things are really expensive. Some of those, especially like the once a week shots and stuff, which those aren't really insulin at all. But there's some of those things are $1,000 a month. $800 a month is their full price. So if you think about that, some people go, well, $5,020 to hit the donut hole. How does anyone ever hit that? Well, I have clients that hit it in the first month because I mean, some of these things are no joke with what the full retail price is. That they could go get according to those prices, they could go buy a new car every month instead of their meds. So,
all right, we're going to take a break. We will be back in a moment, and we're still talking about Medicare open enrollment. Thank you. Hello, DMV. This is Ramona Jones McClain, your insurance guru. I am a farmer's agent located at 11707 Reisterstown Road in Reisterstown, Maryland. Here, you can call me at 443-660-7131 or listen to my show every Thursday at 3 p.m. at podbean.com, The Real Insurance Guru.
As the road you travel changes, so can your insurance need. Talking with Farmers Insurance Agent Ramona Jones McClain can help you assess whether you're ready for the journey ahead. Call Farmers Agent Ramona Jones McClain today at 443-660-7131. That's Ramona Jones McClain at 443.
All right, we are back, and we're talking here with Mr. Jake McGoey, who is located in Reisterstown, Maryland.
Yep, 410 Main Street.
You see at the bottom of the screen. He can assist you in everything with regards to medical insurance and getting you ready. If you want to talk to somebody and ask your questions, find out what program is best for you. His number is at the bottom of the screen, and that number is 443-797-3923. Where are you located, Jake?
410 Main Street on Reisterstown Road. So we're just up in sort of the main old Reisterstown section, right across from the post office.
Absolutely. And listen, do not hesitate. Don't wait until December the 7th. Okay.
I'm checking out early that day.
And say, hey, I know it's the last day, but even if you don't switch, it's worth investigating, mainly because there are some new things happening in the market and things are always changing. I was talking to someone earlier today, and she literally called me 2 days in a row trying to figure out how much money she owed on her car insurance. And she was just fussing. Why does this have to be so complicated? And I was like, we have to have a license, and we have to take classes every 2 years to maintain our license. It was created to be complicated by design. The language, the formulas, the risk assessments, the analysis, all of it. It was literally, and it's going to be that way whenever you get legal contracts involved, and there's lawyers that are creating and designing the language in which we determine how much coverage we're going to give you for what. And I tell people all the time, insurance companies, one job they have is to try to cover as little as possible.
Yeah. I mean, anytime you have a business, they're trying to make a profit. So obviously you've got that going on, but there are some pretty very not pretty. There's some very, very specific laws in place and rules they have to follow. So there's a lot of hoops to jump through to make sure that everybody's playing on the same ground, same by the same set of rules. So
Absolutely. So I was reading something about CMS analysis and the risk model to determine what's going to be more accurate and how that is affecting what the new premium is going to be for 2024.
yeah, so that has to do with the with Medicare premium, with the Medicare Part B premium, and yeah, they take into account what are the different drugs that they're covering that are coming up more and more. Like, for example, there's Alzheimer's medications and there's infusion medications that they end up paying for or subsidizing through Medicare. And whenever those new drugs come out,
Right.
they're very expensive. If their utilization is high, and estimate all that stuff in advance to figure out what it costs to administer the plan, the benefits. And you're talking about covering
But there's some
hundreds of millions of
serious
people.
new Alzheimer's drugs coming out. Like there have been some
Yeah.
real progress with that.
Yes.
And and the cost is
Staggering.
Yeah, it is. But they are seeing real results and prolonging life.
Yep. Yep. I mean, it's always that's always the challenge is, at least with our health system here is, it's great when we have the progress and the new things that, I mean, just the diabetes medication that we were just talking about, the once a week injections that people are getting. I mean, that one of those basically saved my wife's life.
Right.
She was on the verge of dying a year ago and got on one of those drugs, and her blood sugar is amazing. Her A1C is so much better. She's lost 100 pounds. So those things, it's great, but the cost is also what these companies are charging for them is scary high. I mean, like I said, $1,000 a month. That's not even as I've seen ones that are 20 grand a month.
Right. Absolutely. That is I can't even imagine. Like, just kill me now.
Yeah. Yeah.
At my house,
Yeah.
I'll sit on the side of the road with a box. And you just,
That's a whole nother show.
right.
That's a whole nother
we
show.
were talking about last week the different medical programs that really invest in doing the preventive care up front, so that if you're going to get diabetes, the likelihood that you're going to get, because a large part of it is genetics, is just great. Not a whole lot you can do. I mean, there are a lot of different theories about what you can do to keep from getting it, or those who have a greater disposition toward it or not. But the preventive care in determining what your lifestyle is, and that's why I was talking to a 27-year-old today that does not have medical insurance. She just started working for herself, I don't know, a couple years ago during COVID, and she doesn't have anything. And I'm like, you can at least go on to the Healthcare Connection and get something. Just get something. And we ignore the importance of seeing a doctor, of getting care when we're in our 20s, because we think in our 20s we're going to live forever.
Yeah.
But it's the 20-year-olds, and I'm just going to be honest, it's the 20-year-olds that need to go get insurance now, because they utilize it a little bit less than those who are twice their age. And putting the money into the pool allows insurance rates to be less expensive.
Yeah. Well, and not to mention, there are, I mean, some types of insurance you can wait and get when you need it more. But a lot of them you can't, right? There's a lot of different types of insurance that you and I both sell, that if they wait until they are a high utilizer, they can't get it anymore, or the price is going to be so astronomical that they're just out of luck, right?
Right. Somebody was asking me about critical illness insurance today. and they were asking me about my husband and why didn't he have it, and I said, well, I guess 20 years ago you really couldn't get it outside of a life insurance policy. That's
Right.
number one. I didn't know my husband then. Okay. But by the time it was available and you could buy it independently, he already had cancer.
Right.
So you got to wait 5 years. So we
Yep.
waited 5 years. And 5 years later, he ended up with another type of cancer.
Yep. Yep. Yep.
And then 5
Sometimes
years
you're
after that, the first cancer came back. Not the same way. I mean, it's under control and everything. But by the time the product was available and he could get it, he wasn't eligible for it.
right. Yep.
And that's why when you're young, if these things are out here, we may think, oh, I don't want to spend my money on that. It's money. I'm putting money into this. Well, if you're 20 something and in 5 years or when you turn 33 or 32, you get diagnosed with, I don't know, cancer, any kind of cancer, doesn't matter. And you've got this policy, and all of a sudden you get a diagnosis and they send you a $50,000 check.
Yeah. You'll be glad you did it. Yeah. Yep. I know. I've had plenty of clients like that too, where, and I have, people say, well, why do you get insurance on kids? Well, I mean, I have a policy on my stepson who's 35. My wife and I got a policy on him that was 15 years ago when he was 20, a whole life insurance policy with critical illness benefits, and it's now paid up. Right? We got a 15-year paid up policy. We put it in place. We paid for 15 years.
Right.
The premium is now zero for the rest of his life. It's there. The benefit's there. So, I mean, there's a lot of nice products like that are available.
And he doesn't ever have to worry about qualifying again. I mean,
Nope.
I got life insurance for my children when they were babies.
Yep.
I had no idea that when my son turned 14, he wouldn't be eligible for any. And I had no idea that when he turned 18, he would pass away.
Yep.
You just don't know.
Yep. Nope, you don't. And yeah, so anyway, it's called insurance for a reason. By definition, it's in case something happens, not when something happens, right? It's not it's not bail you out. It's help protect you in case of something.
And the thing is that something always happens.
Yep.
The whole thing is that you don't know what, you don't know when, you don't know how, you don't know who.
Right.
But it is safer for you to insure everything. I got insurance on every device I own. People say, oh, you don't need insurance. No, I got insurance on that too. And then I got insurance on all the electronics in my household. Why? Mm-hmm. Because when the pipe bursts, I can call that company that I'm not going to say out loud because I'm upset with them right now, the Shield, and they can send somebody out for $75, $85 to go see what's wrong down in the bathroom in the basement.
Yep.
And then it's fix or it's repair or replace.
Yep.
If they can't fix it, then they got to replace it.
Yep.
And worth it because stuff always happens.
Yep.
You can't think that you're just going to go and everything is going to skip you. That's not what's going to happen. It is better to have it and to know about it and to talk to the people who know about it so you can get the most out of what you need to get. And medical insurance is the same way. There is no reason in this state, the state of Maryland, that you should not have medical insurance. Just none. And this is the time to get it. This is the time that 8, 10 years ago, 11 years ago, we all voted for for somebody who gave us the affordable health plan so that we could go get insurance and not have pre-existing conditions to held against us.
Right. Yep. And that's, I was just going to say, and so we talked about Medicare obviously earlier, but it used to be that was the only annual enrollment period. Now that we have the healthcare exchange, we also have an individual enrollment, annual enrollment period for people who aren't on Medicare, and that starts November 1st. Yeah. So that's still 2 weeks away, and that'll run till January 15th. So they give us through December and the holidays to get to get all of our family stuff out of the way. And if we're going to be procrastinators, we can do that in January. But yeah, so that's a very important time of year. But I have, every year people come in March and April and June and they say, oh, I want to sign up for health insurance now. And I say, well, did you just change jobs and lose coverage, or why now? Well, I just decided now I'm finally ready to do it. Well, that's good, but and I say, but you got to wait. Well, I thought we had healthcare for everyone now, that everyone can get it with no health questions. Well, you can, but you have to actually do it during the time of year when the enrollment period is on. It doesn't mean that you're free to start and stop just any old time, carte blanche throughout the year. So
Right.
it is, it's important that you take advantage when the time's there, and they give us a pretty good amount of time. I mean, we're talking about 2.5 months.
2.5 months.
That's like a quarter of the year.
Yes,
Yeah,
it really is.
I don't know how much longer you need it to be, because just remember, we have to work really hard for that 2 months or 3 months
Yes.
that to keep up with y'all coming through. But
So look, what companies are out for Advantage plans, and what companies are available for supplement plans for Medicare?
Okay. So for Medicare this year, we have Aetna coming back into the market in 9 counties of Maryland.
Okay.
So Hartford County, Baltimore City, Anne Arundel, Howard, Carroll, Montgomery, and Frederick.
Okay.
No PG on that one. We have, now that's exciting because they did have a plan in 3 counties a few years, but back in like 2015, 8 years ago, they pulled the majority of their plans out of the whole state, and they just left one plan in 3 counties that was like $100 and something a month, and nobody wanted that anyway. It wasn't a good one. But now this year they're back, and they're in those 9 counties with Medicare Advantage plans. They have a couple different options depending on what your situation is. If you're on Medicare, Medicaid, if you're whether or not you want a 0 premium plan or you want a plan with a little higher premium and lower copays, but really nice benefits and a great doctor network with that one. Humana is also available now in Maryland. We had many years where you'd see the commercials all over the television, but there was no actual plan available here. So they are in almost every single county of the state this year for 2024 with Humana, and they have a bunch of different plans available. They actually have Aetna and Humana and United Healthcare. All 3 have some really exciting plans. If you're a veteran and you have veterans benefits, they have some special plans that are available now, because the idea is that with the veterans, they can get their meds through the VA, right? And so if you're getting your meds through the VA and they're not providing you with the drug coverage, they're just providing you with the health side, and the benefits are really nice on those plans. I can't give details on the air like this, but because there's disclosure forms that have to be signed and all that kind of stuff before I'm allowed to talk about the specifics. But they are really,
Right.
If you're a veteran, definitely need to ask about it, because you can only sign up during the enrollment period for those plans. There is no exceptions. You can't get it any other time of the year. This is the only time, period. So other people, there might be some exceptions that could be used to enroll them outside of the annual period. So Aetna, Humana, United Healthcare has various plans depending on the county you're in. They have statewide plans for people on Medicaid, and then they also have plans in a number of counties for people on Medicare and Medicaid. I'm sorry, just Medicare without Medicaid. We have also Care First, of course. We have Kaiser Permanente, of course, which are both, fairly big local companies, or have Kaiser's not local per se, but they have a big segment here.
Yeah, right.
And then we also have a company called Alterwood. That company is a local plan based out of Hunt Valley. Actually, it's a local insurance company that's just in Maryland, but it is in the whole state. It's all the way across the state of Maryland with their plans. They have plans for Medicare and Medicaid, and they also have plans just for people on Medicare. their benefits are also very, very attractive, and their colors for their logo are purple for the Ravens, which tells you how local they are, right? So that's pretty cool. I guess that's pretty much the list. Oh, Johns Hopkins has plans as well, so that's another one that we have available.
Yeah, they're limited.
Yep. They're limited. They're limited by county and the plan type. They have a lot of counties, but they left Baltimore City, and of course that was a big fuss about that. So a lot of people are not big fans of that health plan at this point. So
I'm sure.
So anyway, yeah, that's sort of the layout of the Advantage plans. Now the drug plans, there's WellCare, Aetna, United Healthcare, Cigna, Mutual of Omaha. Trying to think. There's all in all, there's about 30 different potential drug plans from about, I think, 5 or maybe 7 different companies in total, but they have multiple plans for each company does. And then the Medicare supplement plans, oh God, there's more than I could even tell you. There's probably 50 different companies that you could buy a Medicare supplement from.
Good.
And of course, there's the big names and the local names that Care First, United Healthcare, Aetna, Cigna, Humana. And then there's a lot of life insurance companies and property and casualty companies that are now getting into it. ACE is a Medicare supplement company I represent, one of them, one of the 35 that I can sell. They're owned by Chubb, which is a big, I'm sure very big company.
Right, and they do high valued homes and
all kinds of stuff.
A lot of different property
Yep.
stuff. Right.
There's Allstate now has MedSups available that are competitive here in Maryland. They have some interesting discounts. They're trying out a wearable fitness tracker discount. So if you will have a phone with a step counter or a Fitbit or anything that tracks your activity and you register it, they'll provide you a discount on your Medicare supplement price. Sign up for this through this, now with the new plan they have.
And what plan is that?
That's Allstate is the company. So they offer the same.
Okay.
And the thing about the Medicare supplements, right, is that they have letters like Plan G, Plan N, and those plans, the Plan G is the same benefits as far as how they work for every single company. If you buy it from Care First or whoever, it's all about what price do you get. That's all that matters. It's the same gallon of milk. It's just what are they charging for it? So but Allstate has that which I thought was funny because it reminded me of like the car insurance companies with that little thing where you plug it in under the dash and it sees if you're a dangerous driver or not, right? If you stop too hard, it's gonna beep beep beep, and then nope, there goes your discount. You're out the window. You're getting charged more because you stopped too hard. It kind of reminds me of that. You gotta plug in your step counter, and the insurance company's watching to see your discount, but.
How much activity you get.
Yeah, right. Now they do tell you right out up front that it's not based at all on how much activity you have. It's just a 5% discount if you agree to do it. And I think they're
right, but insurance companies are all about analysis and statistical variation.
They want to see.
They are determined. Right. They want to see based on what you're doing or what your step counter says, what is your actual, what is the analysis of what your health is and where is it going?
Is there a correlation there? Because eventually they can come out with one and say, we'll discount you more based on your activity or something like that. Right now it's just them gathering information for analysis, like you said. But then, Humana just is refreshing their prices on their plans locally for MedSup. So they're going to be really competitive. Like starting next month, we have new pricing that just came out for Humana of MedSup. So they look like they'll be really good priced moving forward. And then, of course, the biggest thing really with Medicare supplement in Maryland is that there was this new birthday rule legislation passed. I think we talked about that last week. I don't know. Did we?
No, we didn't. Not.
So there's
what is
so
it?
there's 2 laws passed in Maryland that took effect this year. One was had to do with the Medicaid wind down. they said anybody who
Okay.
lost Medicaid had a 63-day guaranteed issue window to buy a Medicare supplement. So with no health
Okay.
questions, that wasn't the rule. I mean, that wasn't the case before. If you lost Medicaid, you just lost Medicaid, and you
Right.
couldn't necessarily go get a Medicare supplement. So that was cool, and that's a one-time thing. I mean, because it's not very common. The birth,
Right. That's coming out. That's post-COVID
yeah.
stuff.
The second one was that every year, starting July 1st, that just went by, and so it's in effect now. Every year, if you're already a Medicare supplement beneficiary, so you have a plan, every year on your birthday, you have a 30-day window that you can shop your plan. You can go to another company offering the same benefit or lesser benefit without health questions. Or with your same company, you could take a lower benefit with no health questions. So you could reduce your coverage to lower your premium. Reason that's important is that historically people would buy a Medicare supplement and they'd buy, and they'd be on a company that maybe was a good price when they bought it, but that company, let's say, didn't get enough people in their pool, or
Right.
just the people in their pool happen to be really sick, and so their prices start to go up because their prices, they can't just raise their price astronomically with no reason, right? The state doesn't allow that. It has to be based on the actual claims that are
Right.
being made. So they're only allowed a certain percentage profit. So
Right.
so
And how much money they have in reserve
yep.
and
But
right.
yeah, I mean, they can't just say, well, we're going from 200 a month to 400 a month, but we're going to make, and so we're going to make triple the profit. No, they're only allowed a certain percentage profit. So the state would say, we have to see your books. You have to see how much did you pay out in claims, and it has to be within a percent. It has to be within a certain limit that they can't raise the price more than that. So a lot of them operate
Right.
on a loss some years, because when they're operating on a gain, it's only 3%. But they might
Right.
let their claims creep up into where they're losing money for a year before they push the price up again. But the bottom line is, there's people. I mean, I meet people all the time that are paying $400 for a Medicare supplement, and they're 78, 80 years old in a lot of cases, so they've been on it for a number of years. But the company that they joined, the price has gone up, 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 and now they have health conditions. They can't, before this birthday rule, they were stuck. They could leave a
Right.
supplement entirely and go to an Advantage plan, or they could just leave and just have nothing, which wouldn't be very wise either if they have health problems. But they didn't have a choice to go get a different supplement because of their health. Now
Right.
everybody has the opportunity to shop their plan every year on their birthday. So
That's
you have a
nice.
30-day window. So you want to talk to a broker because they can at least compare all the rates and see which ones are going to be
Because
competitive.
it's a million carriers in the market right
Yes,
now.
yes. I mean, literally, when I put it on my computer screen, I can scroll with my finger. I can scroll, 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 scroll 4 or 5 times to get from top to bottom on one letter. That's just on Plan G, right?
Right.
So, I mean, you can imagine if you put all of them on there, it's an Excel spreadsheet that, takes up a whole thumb drive to get all the information just for one person's quotes.
All right. Well, Jake, we are going to wrap it up. I have definitely enjoyed this. We're going to talk because, open enrollment is next week, October the 15th. And it is time for all of our seniors, our retirees, to evaluate. You see Jake's number at the bottom of the screen. It's time to call him. Do not wait until December the 7th.
Mm-mm. Nope.
Okay. Jake said he's going to have lunch and not coming back for a week.
At least a week.
Okay. So listen, it's time for you to take a look at what you got, take a look at what's available, look at what's available in the market. There are so many different options that are out there right now. And don't forget to pull out your medication list so Jake can put it into the system and see which one is going to be the best one for you. You see his number at the bottom of the screen. If you have any questions, you forget his name, call me. I'm at 443-660-7131. And Jake, I'm gonna be calling you so we can look at Russell's stuff.
Sounds good.
again.
Yep. And the best part
Okay,
about all of it
thank
is there's
you.
no charge for the help. So, right? We didn't even mention
That's
that, but
right.
yep, no cost for it.
Absolutely.
So happy to help.
Absolutely. Thank you, DMD. We are out. Woo!
Hello, Ramona. I can't shake the simplest feeling beyond the ghost. We stand on the opposite shore. Hello, Ramona. I reach through mysterious ceilings, my only hope. I look for